In today's video, we are going to learn about two important mnemonic related to diaphragm. One is related to congenital diaphragmatic hernia, that is PH and LH in DH, and another is I8 10X at 12, that is a mnemonic to remember structure passing through the diaphragm. Many prognostic factors for CDH patients are described. Mnemonic for poor prognostic factor in congenital diaphragmatic hernia is PH and LH in DH, where PH stands for pulmonary hypoplasia and pulmonary hypertension, and AN stands for associated anomalies, LH stands for lung to head ratio and liver in hemithorax, and in DH stands for diaphragmatic hernia. Numerous causes contribute to the poor outcome of this condition. The two main factors that heavily influence the prognosis of CDH patients are pulmonary hypoplasia and pulmonary hypertension. Congenital diaphragmatic hernia is congenital defect in formation of the diaphragm allows the abdominal organs to push into the chest, leading to lung hypoplasia and pulmonary hypertension. The diaphragm is a sheet of internal muscle that extend across the bottom of rib cage. It separates thoracic cavity, heart, lung and ribs from abdominal cavity. The majority of these cases have an isolated CDH with pulmonary hypoplasia and pulmonary hypertension, but CDH can be associated with chromosomal aneuploidy such as trisomies. Most of the cases, the causes of CDH is not known. In some cases, CDH can be linked to a genetic disorder or a random gene changes called mutation. Turner syndrome, Down syndrome, Edwards syndrome, Patau syndrome, Pallister-Killian syndrome are several among syndromes in which the CDH may occur. Some of these syndromes are caused by changes in the single genes and others are caused by chromosomal abnormality that affect the single genes. Syndromic CDH is rare, but these children have lower survival rate. LH is lung to head ratio and liver in hemithorax. The LHR or the lung to head circumference ratio is a sonographic measure that has been reported to identify fetuses with congenital diaphragmatic hernia and that have poor prognosis. Fetal lung volume is measured by the lung to head ratio, which is obtained from the contralateral lung area divided by the fetal head circumference. Fetal lung to head ratio measurements have been used to predict neonatal pulmonary hypoplasia. The value of ratio is very important. All newborn died if the ratio reaches 0.6. On the contrary, they would survive better with survival rate of 100% if the ratio is reached above 1.4, while the ratio between 0.6 to 1.4 had a survival rate of 65%. The presence of herniated liver in the thorax is known to affect not only the lung development but also cardiac one. Newborn with CDH often presents with left ventricular hypoplasia with reduced systolic performance. 5%. Liver position referred to whether or not portion of liver has herniated or gone up to the chest of the fetus. Fetus with liver up in the chest have more severe form of CDH and a lower survival rate. Liver down CDH babies have a good chances for survival rate. There are numbers of openings in the diaphragm through which structure passes between thorax and abdomen. There are three major openings. The opening for aorta is known as aortic hiatus, and one for the inferior vena cava, that is called caval hiatus. Esophageal opening is known as esophageal hiatus. One can remember this with the mnemonic I8 10X at 12. I stands for IVC. 8 sounds like number 8, so T8. IVC crosses the diaphragm at T8. 10 is level T10. X, E for esophagus and G for vagus. So esophagus and vagus nerve crosses the diaphragm at T10, and 8 A and T. A stands for aorta, another A stands for esophagus vein, and T stands for thoracic duct at the level T12. So this three structure crosses the diaphragm at T12. T8, we need to remember one more structure, that is right phrenic nerve, and how we can remember is in IVC it is inferior vena cava, so inferior itself is having a fur, so we can remember that at level T8 along with IVC right phrenic nerve also passes diaphragm. Thank you for watching this video on mnemonic related to diaphragm. I hope you all understood and learned well.